Leadership in healthcare is often seen as just giving orders and managing schedules. But what if the most powerful lessons actually come from surviving a snake bite alone in the Amazon jungle?
That's quite an unexpected connection. What's the story there?
Well, I've been reading about these fascinating 7 commandments of clinical leadership developed by a physician associate, Colonel James Jones, with over 36 years of military experience. He was bitten by a pit viper snake deep in the Amazon. No backup, no medevac, no morphine. And that experience shaped his entire approach to medical leadership.
Hmm. How does someone translate that kind of extreme situation into everyday healthcare leadership?
That's what's so interesting. He found that split-second decision-making under pressure is actually a muscle you can train. Like this example where a junior medic noticed increasing heat injuries during training operations and created a color-coded hydration tracker that cut evacuations by 60% in just 1 quarter.
So it's about empowering people at every level to take initiative?
Exactly. And here's what's really fascinating. They built entire systems around this idea. They implemented something called Protected Training Thursdays, 2 hours weekly, just for hands-on skills, zero interruptions allowed. Medical errors dropped 22% during field exercises.
Those are impressive numbers. How do they maintain that kind of focus in high-pressure environments?
Well, that's where the cultivate the coalition principle comes in. There's this amazing case where a brigade PA noticed problems with duplicate appointments and medication errors. Instead of just adding more paperwork, they created an integrated care task force that met weekly. Patient satisfaction jumped 31% and missed follow-ups dropped by 19%.
You know, that kind of cross-functional collaboration is exactly what healthcare needs more of.
And here's the thing, they don't just focus on systems, they prioritize people too. They actually created these medic reset centers with yoga mats and quiet spaces. Within 90 days, behavioral health referrals dropped 45% and retention improved significantly.
That's such a departure from the typical tough-it-out mentality in healthcare.
Right. And during COVID, one clinic leader applied these principles by integrating logistics and case management into daily provider huddles. This simple change got people back to duty 48 hours faster on average.
How well do you think these principles would translate to civilian healthcare?
That's what's really powerful. The challenges are universal. Whether you're coordinating multinational medical operations or running a small clinic, you need to build trust, manage time effectively, and maintain team resilience. Like this joint exercise in Eastern Europe, where they cut evacuation times by 6 minutes just by creating better communication protocols.
Those minutes could literally be the difference between life and death.
Exactly. And you know what really stands out? Everything is measured. They don't just talk about good leadership, they track concrete outcomes. As the author puts it, leadership without empathy is like medicine without healing. It's about creating environments where both patients and providers can thrive.
That's a powerful shift in perspective, from seeing leadership as authority to seeing it as creating conditions for success.
And that's really the key takeaway. Good leadership isn't some mysterious art. It's a skill that can be taught, measured, and improved. When they implemented these principles, they saw measurable improvements across the board, from patient outcomes to team morale to operational efficiency.
Sounds like healthcare could learn a lot from this approach.
Well, as the author showed through his own journey to becoming a senior executive military medical leader, it's not about having perfect people. It's about creating systems where imperfect people can perform perfectly together. Colonel James Jones always states, "Be all you can be in the Army." With strong leadership and collaborative healthcare models, PAs will always go beyond.